Download Tarang online radio app from Google Play Store.
When we talk about the leadership, ma'am is guiding us and ma'am is taking care of the National AIDS Control Program, and time to time the reviews and the instructions which we got from ma'am are really useful in making this program useful. Now may I request Honorable Minister to kindly address the gathering, because these people are very much interested in listening to you, ma'am. Please kindly address the gathering.
Our Additional Secretary, ASNDG NACO, Shri Sanjeev Kumar ji, Dr. Bekidam from the WHO, Dr. Bilali Kumara from the UNAIDS, Joint Secretary, Shri Alok Saxena ji, Shri A.K. Kaushal ji, Shri Naresh Goel ji, our representatives from the civil society, PLHIVs, media, ladies and gentlemen. It indeed gives me a great pleasure to join you all for the World AIDS Day. And I think today is the perfect opportunity for me to recognize the effort of every person who has been associated with NACO at the central, state or the peripheral level and has led the program and has made it successful in halting and reversing the incidence, the tide of epidemic HIV, which is staring India in the face. I also take this opportunity to recognize the positive voices we heard today, because they are the real source of inspiration for each one of us, the real motivator who help us strengthen our fight, our efforts towards ending this epidemic by 2030 as a public threat in India. Ladies and gentlemen, I'm glad to tell you that the adult HIV prevalence has come down from its estimated peak of 0.38% in the year 2001 to 3 to 0.22% in the year 2017. And as we move towards our target of achieving the SDGs for HIV/AIDS, ending the epidemic by 2030, the government of India is leaving no stone unturned to make sure that we achieve our targets, and every concrete step is being taken. And I feel very proud to tell you that while world over, in many of the countries across the world, the funding resources for HIV/AIDS program are facing a constraint, the government of India is not just fully funding this program, but is even committed to increasing the resource envelope in accordance with the needs of this program. And there are about more than 1 million people in the high-risk groups, which we are focusing on. And we have kept the infection under control through our target interventions. You saw we released the operational guidelines for our interventions for TB and HIV in the prisons as well. We're doing target interventions with the truckers and migrant populations. So we have tried to do these target interventions and keep the infections under control. We have also focused on eliminating the mother-to-child transmission of HIV and syphilis by 2020, and there is another parallel program we are running, the Pradhan Mantri Surakshit Matrit Abhiyan, under which we provide antenatal checkup facilities for all our pregnant women across the country on the 9th of every month in designated health facilities in partnership with the private doctors, wherein we check the women not for every other thing but even for HIV. So more than 2 crore HIV testing among pregnant women has also been undertaken. Then the program also lays emphasis on counseling and testing among the general clients, and the NACO has undertaken the community-based screening for HIVs in order to reach the first 90 out of a target of 90 by 2020. So this 90 means we want 90% of the people to know their HIV status. We want 90% of the people to be put on treatment and 90% of the people to be put on viral load suppression. That is our target by 2020. And we want to end the epidemic by 2030. We have also started the test and treat. And under this, now every person who's being tested positive for HIV is eligible to be put on ART irrespective of the CD4 count. One of our positive voices who were here today, she expressed her concern about not being put on ART on time. But now we have removed that barrier of CD4 count. So the moment you are tested positive, irrespective of your CD4 count, you're going to be put on ART. That's one thing we have done. And with this, more than 70% of the PL-HIVs are now on ART, and more than 12 lakh people have already benefited from it. That's one of our success stories. We even have started the viral load testing, which you know is very important. It is of immense importance because it helps us to monitor the effectiveness of the treatment on which the PL-HIVs have been put. And the implementation of test and treat strategy is also being complemented with the vigorous execution of Mission Sampark, which we launched last year while we were here together for the World AIDS Day, that helps us to track the lost to follow-up cases. So, and another most historic move has been, of course, the launching, the coming up of the HIV/AIDS Prevention and Control Act 2017. The rules have come thereafter in 2018, which provides an enabling environment to all the PL-HIVs so that they are able to not just get seamless access to services, but they also have a grievance redressal mechanism with an ombudsman at the center and a complaint officer at the establishments level. So we are trying to protect the PL-HIVs by means of this act which has come into force and which is one of the very big historic achievements of this government, the government led by Honorable Prime Minister Shri Narendra Modi ji. My dear friends, I also want to emphasize here that HIV is not just a health issue, but it is influenced by a number of socio-economic factors as well. So when it comes to response to HIV/AIDS, it has to be multifaceted, it has to be multi-sectoral. And this is precisely why the Ministry of Health and Family Welfare has signed MOUs with 60 odd ministries in order to augment a comprehensive AIDS response. Other than this, it has also signed MOUs with more than 250 industries, both in the public and private sector, to mobilize their support for fighting the epidemic. Government of India, as you heard the other speakers, it has also launched the recent initiative of integrating the TB program with the HIV program. So this will further give a renewed impetus to our national response to both TB and HIV. We have our target to make India TB free by 2025, which is 5 years ahead of the global target date of 2030, and ending AIDS epidemic by 2030. So we are trying to club two programs and work simultaneously. And I expect that we all will work together, the civil society, the community, the development partners, the NGOs, and all other ministries with whom we have signed the MOUs in order to fight this menace which is staring us in the face. So finally, on this occasion, let us all pay our tribute to all those lives which have been lost to HIV/AIDS. I wish to assure you from Government of India that we are there to offer any kind of support you need from us. And I would only say that if we all are together, we can fight this epidemic and we can make India HIV free by 2030. Thank you very much, all of you.